Good morning.
Morning.
My name is Deepti Vyas, and I'm going to be presenting my patient Rodney Cross to you today.
Fantastic.
So Rodney Cross presented to the emergency department with a chief complaint of leg pain and redness. The patient is a 57-year-old Caucasian male who presented to the emergency department because of pain in his right leg. He states that he awoke with the pain about 3 days ago and that it has been continuous, although it does hurt more when he walks.
Okay.
The pain is located behind his right knee and extends down to his calf, and he rates the pain intensity at about 3 out of 10 at this time. He does report recent travel on a 14-hour flight to London. As far as pertinent past medical history, he does have hypertension, diabetes, and he did have hip surgery about a month ago. He also smokes 1 pack per day for the last 25 years, and his father has a past medical history of ischemic heart disease. On interview, the patient stated that he hates needles and would prefer something oral to manage his leg pain. Other information, he does have a sulfa allergy, which has been known to cause hives. His current home medications include lisinopril 10 milligrams PO daily, aspirin 81 milligrams PO daily, and atorvastatin 40 milligrams PO daily. On review of systems, his cardiovascular review was clear, no chest pain or palpitations. His respiratory exam was also clear, no cough or shortness of breath. His musculoskeletal review does show that the patient has pain in his right knee, which is rated at about 3 out of 10. A neurological review was clear as well, no dizziness or headache noted. On physical exam, the patient is somewhat overweight. However, he does appear comfortable and he's able to ambulate at this time. His vital signs were also normal, blood pressure of 132 by 76, a pulse of 75, and oxygen saturation of 97% on room air. He weighs 194 pounds and his height is 6 feet. His lungs were normal. His cardiovascular exam was normal as well. His musculoskeletal exam showed that his right calf was tight, warm to touch, and tender with 1+ pretibial pitting edema. His left lower extremity, on the other hand, was normal. No warmth, no redness, or swelling noted. However, both lower extremities had normal pulse and sensation. And then the range of motion was also normal. Pertinent labs include BUN of 22, a serum creatinine of 0.8 milligrams per deciliter. His CBCs are within normal range. His D-dimer was elevated at 2975 nanograms per ml. EKG was normal, no T-wave or ST changes were present. His venous Doppler ultrasound, on the other hand, of his right lower extremity did show a deep vein thrombosis that ranged from the right popliteal vein to the right common femoral vein. His chest x-ray was also negative for pulmonary embolism or any other symptoms. So my assessment is that this patient is a 57-year-old male who presents with signs and symptoms that are consistent with a deep vein thrombosis, negative for pulmonary embolism. The patient is a candidate for outpatient therapy with an oral anticoagulant based on the patient's ambulatory status, normal vital signs, and lack of evidence of renal dysfunction. The patient's creatinine clearance is approximately 100 mL per minute. Available therapies include warfarin, direct-acting oral anticoagulants, and fondaparinux or enoxaparin, bridged with either warfarin, dabigatran, or edoxaban. However, since the patient would prefer to avoid needles, available options are rivaroxaban and apixaban. According to the antithrombotic therapy for VTE guidelines, this patient is a candidate for 3 months of anticoagulant therapy. So my plan would be that I would recommend rivaroxaban 15 milligrams PO twice a day with food up to day 21. At day 22, the patient will start 20 milligrams of rivaroxaban taken once a day with food for a 3-month duration. Early ambulation and adequate fluid intake is also recommended for this patient. As far as implementation, I will relay these recommendations to the patient's physician with your blessing. I will also counsel the patient to take 1 15 milligram tablet of rivaroxaban with food twice a day for 21 days, and then 1 20 milligram tablet daily after that. I will, for about a 3-month regimen. I will ask the patient to monitor for any signs of bleeding, including black tarry stools or epistaxis. As far as follow-up and monitoring, the patient will monitor for any signs of bleeding, any signs and symptoms of a DVT such as leg pain, inflammation, or redness, any signs and symptoms of a pulmonary embolism such as shortness of breath, coughing, or hemoptysis. I will have the patient see his primary care provider in about 2 weeks. And that's the end of my patient case presentation.
Thank you very much. Thank you. So that was an example of a patient case presentation. Now we're going to move on to the prescription consultation portion. So I'm going to hand the student the prescription for rivaroxaban, and she is going to counsel me as I am a patient. So please go ahead.
Okay, great. Hi, my name is Deepti Diaz, and I'm the pharmacist on duty here. I see that you have a prescription here, and I was wondering if I could take a second to go over it with you.
Sure, that's not a problem.
Great, thank you. Before I go into the prescription, can I confirm your name and date of birth?
Rodney Cross, 4/4 of 1960.
Okay, great. Well, I see that your physician has written a prescription for Xarelto, and I was wondering, what did the doctor tell you this medication is for?
He didn't really say a whole lot, and I don't really remember too much, so.
Okay, well, this is for a blood clot in your right leg. I'm assuming that you have a blood clot in your right leg?
That is correct.
Okay,
yes.
and so this is a blood thinner. It's meant to actually prevent another blood clot in your leg or in another organ system such as your lungs. How did the doctor tell you to take this medication?
He didn't say much about that either.
Oh, okay. Well, I'll be happy to go over it with you. So your doctor has written for one 15-milligram tablet taken twice a day for the first 21 days. At day 22, you're going to switch to 20 milligrams, and that will be taken once a day.
Okay.
This medication should be taken with food, be it the 15 milligrams or the 20 milligram tablet. It appears that your doctor has written for a 3-month regimen. So what did the doctor tell you to expect from this medication?
Yeah, he didn't say a whole lot about that either. He said most people take it pretty well without a lot of problems.
Oh, great. Yes, it is actually usually well tolerated. However, it is a blood thinner, so it can cause a bleed. Please report any uncontrollable bleeds, especially look out for any black tarry stools, or if you have a nosebleed that's just continuous and it's not stopping, let your doctor know about that too. You know, as far as the blood clot that you have in your right leg right now, your body is able to dissolve that on its own. And this medication is really to prevent a second clot. So, but your body might take a while to dissolve the clot, so that redness and pain that you have right now might continue for a while, and it might take a long time for that to go away. If you have pain that you cannot tolerate and need a pain medication for, I would recommend Tylenol for that. That's the best option over the counter for pain relief.
Okay.
However, there are other options such as ibuprofen and naproxen that I would ask you to avoid because they can cause stomach bleeds. So avoid ibuprofen and naproxen. If you do need something for pain relief, just see your pharmacist first before you take anything, although acetaminophen will be your best bet in this situation.
Alright.
Okay. If you miss any doses of your medication, take it as soon as you remember, because that can happen from time to time.
Yes.
But if it is close to your next dose, within a couple of hours of your next dose, don't double up, just take your next dose as you would and then continue your schedule.
Okay.
Just some storage information for you. This medication doesn't require any special storage. Just store it in a cool, dry place. Avoid your bathroom cabinet if you can. So just so I haven't missed anything, could you go over how you will take this medication?
So I'm going to take one tablet twice a day with food, right?
Yes, that is correct.
Okay.
You will do that for the first 21 days. Subsequently, at day 22, you will switch over to a 20 milligram tablet and you will take that once a day with food.
That's right.
For about 3 months.
Okay. That's right.
Your doctor has written enough refills for 3 months, and then at 3 months, you might need to continue it longer, and that will be revisited at your primary care provider's office.
Okay.
What questions can I answer for you?
Does this have any interactions with my current meds?
You know, I have taken a look at your medication profile. I don't see any major interactions. However, if you do start any new medications, make sure to talk to your pharmacist or your physician first.
I'll
Let
do
them
that.
know that you're on the blood thinner Xarelto, and that way we can keep an eye on any changes in your medications.
Okay.
What other questions do you have?
Nothing else I can think of.
Well, great. Please do not hesitate to call us at the pharmacy if you do encounter any problems or if you have any questions. We're always happy to help you.
Okay, great. Thank you very much.
Thank you very much. Best of luck.
All right, thanks. Okay, so now we're going to move on to the third part. This is the question and answer where your facilitator will ask you several clinical questions about the case. The first question I have for you is you mentioned that the D-dimer was a positive marker for a DVT. What exactly does that signify?
Okay, so the D-dimer is a fibrin degradation product, and what that is that it's released from fibrinolysis of a blood clot. And that is a good marker of thrombosis. As the blood clot is actually breaking, you do see the fibrin products released. The test does have a high sensitivity in that a negative result essentially rules out thrombosis, but it has a low specificity in that a positive result does not always mean that it is a deep vein thrombosis.
Okay, very good. So can you tell me how rivaroxaban works, what the mechanism of action is, and in the management of a DVT?
Okay, so rivaroxaban is a direct-acting oral anticoagulant. It inhibits platelet activation and fibrin clot formation by a direct, selective, and reversible inhibition of factor Xa in both the intrinsic and the extrinsic coagulation pathways. So essentially, it's going to prevent a second blood clot in the patient, since a patient that presents with DVT is at high risk for a second DVT or PE.
Okay. All right. So now you've put the order in, and now you've just been informed that rivaroxaban and apixaban, both those agents, are not covered on the patient's insurance. What would be your next recommendation?
Okay, in that case, I will recommend enoxaparin, 80 milligrams sub-Q taken every 24 hours, and then start dabigatran, 150 milligrams PO BID, starting on day 5 for the full 3-month regimen.
Okay. And the last question is that the physician calls back and says for the rivaroxaban, he wants to order factor 10A levels every month. What would your response to that be?
So for rivaroxaban, you don't need to monitor anything for therapeutic efficacy. So anti-factor 10A levels would not be necessary for monitoring this patient. Instead, we'll have the patient monitor for any signs of bleeding. Those would be more important markers than anti-factor 10A levels.
Okay, great. Thank you very much.
Thank you very much.
All right. That's it.